Hello, good evening. How are you doing? Welcome again to another session of Ask the Doctors. Today is the 2nd of July 2023. So, happy new month. How are you? Have you been? This program holds every Sunday by 8 p.m. Why are they speaking English? Oh, good. Okay, let's go. Let's go. No problem. Now, for those watching this session for the very first time, this session here on this page for teaching only. We only educate. We don't prescribe medications. We don't make diagnosis. All we do here is to teach. Please. So in case you're here watching me and you're looking for treatment on social media, this page, we don't treat anybody. We don't prescribe medications for anybody. We encourage you to go see your doctor. On this page, and the doctors you see on this page are licensed medical doctors, not doctors that just woke up and call themselves doctors. So any doctor you see on the page, they are licensed, and all we do here is to teach you. Good. So how are you? Where are you watching me from? Good evening, everybody. Cynthia, Princess Cynthia, thank you for the likes. I see you. Um, I can see some people. Okay. We have two people on YouTube who they watch me on YouTube, watching on Facebook. Yeah. Good evening. Good evening. Welcome, everybody. Welcome. How you day? How you day? For those we go to watch this video after we don't end. Sorry, we no go fit respond to you because you will watch a session we don't end. But for those where they live with me, welcome. Tell me where you dey watch me from. Princess liked this session. Mercy David, I see you. Thank you for liking. Osman Sidibe, thank you for liking. Alex Jonathan, cleverly lights, thank you for liking. I see you all. Thank you very much. So I beg. Here we know they prescribe medication. We know they give number out. You understand? We know they interested in. I want to call you. Oh, come and buy my medicine. We know they do that one here. Here you get. The doctors on this page are licensed medical doctors. Doctors wey dem give license, wey dey treat human beings, people. No be say they just wake up one day, they call themselves doctors. I'm saying this for certain reasons, you understand, to let you know the people wey dey for this page. From Sierra Leone. From Sierra Leone, I love your program. Thank you very much. So today is question and answer session. Question and answer. Good evening from Lagos. How are you? Ola, Ola Alpha. So if you get questions, feel free to drop your questions. My name now, Dr. Frederick Unibohai. I'll be the host for this program. Dr. Israel Irobonose is the co-host. He will soon join us for this program. And when he come online, you too will see him. And we will take your questions. In case we not take your questions, no vex. Not be say we no one help you or we no one respond to you. Maybe we not see your comments or your question come late. You understand? And not be say we know everything. Oh, I beg. Some people come online thinking that you have all the answers. No, we don't have all the answers. Some people come online to test your knowledge. So I beg, if you dare here to test our knowledge, you go there disappointed. Good evening. Good evening. Esther, how are you? Let's see. Esther, thank you for the love. Annie, hey, I want to give a shout out to somebody. I'm not going to mention the person's name. I want to give a shout out to somebody. So I know you don't watch me. So I guess I'll give a shout out, Abby. Okay, good. I see what you did. So, ladies and gentlemen, I'm giving a shout out to somebody. The person's name. Okay, there is Sunday in the person's name. Yeah, I see you. Let's go. Thank you. Who did YouTube? Good evening. Watching from UK. Interesting. Helen, how is the UK? Watching from where? From Oka. Daniela. Okay. If you have a question for me, please drop the questions right now. Drop your questions. Or I beg, no ask for any medicines. We know they give medicines on the internet.
Ask the doctors.
What be this?
Helen, how is the UK? Watching from where?
Shut up. I don't have questions. Just here to say hi. Oh, okay. I am a medical doctor, but I'm really learning a lot. May God Almighty blessings be on you and your program. Really, thank you, sir. Thank you very much. Thank you, thank you, thank you. It's an honor, It's an honor to have you. Thank you. Confidence. Good. How are you? I did fine. I did fine. How is your family? Watching from Lagos. Okay. Thank you very much. Okay, good, good, good. Good evening, everybody. Welcome, so let's just please. I know that some people, yes, some people have been sending private messages. Dr. Israel is in the house. Share the live, ladies and gentlemen. Please share the live, share the live, share the live. Dr. Israel,
Good evening.
good evening.
Happy Sunday.
Happy Sunday. How are you?
I'm okay.
Yeah, nice to see you again. I just hope that your network would support us today. Hmm?
Me too.
Okay, good, good, good. For those that have been trying to send private messages, no vex, no vex. On social media, we know they do private chats. I know they do private chats. I know they give number. So if you get questions, I beg, ask your question here. Hmm? Okay. Somebody says, Dr. Israel. He says, Doctor,
Yeah.
I just the poo poo like water for the past 1 month now. Waiting fit cause am.
Okay. Many things fit cause am, but if you don dey poo watery for the past 1 month, abeg, I think you should go to the hospital. I cannot imagine you just dey watery for 1 month and you still dey very healthy and nothing. So you need to go hospital quick quick. Make dem for find out why you dey like that. They may want to test the make dem know whether anything dey and to know the kind of medication wey dem give you. But for the now, before you go hospital, you fit dey take, abeg, anytime you try dey take a lot of water. Try dey take a lot of water. That will help to build your, make you no lost a lot of fluid before you decide to go hospital. But I would tell you, say it will be better you quickly go hospital so that make dem for see wetin dem go fit do for you.
Yeah, thank you, Dr. Israel. Dr. Israel, check your WhatsApp. I dropped a message on your WhatsApp. So, Daniela, thank you for the likes. Zobright, Oluwaseun, Confidence, Charity, Sarah, IB Movic, Importer, thank you for liking this live session. And then the other people that sent love, thank you for sending the love. Thank you very much. Please, everybody, share the live. Okay, let's take this comment here. Let's take a comment here. Let's see. We have a question from Charity. Doctor, what causes back pain? Okay, let me respond. Dr. Israel, check your WhatsApp. Let me respond. Charity, this question on back pain, we don't do video on back pain. That video did the page. Now, because of time, we could just tell you small. But when you go watch that video, we broke it down. Me and Dr. Israel on this program, we spoke about back pain. So try go watch am. Many things dey wey fit cause back pain, whether na your age, whether na the kind job wey you dey do, whether you dey stand for too long. Many things dey wey dey cause back pain. Yeah. Let's take another question here. Let's take another question here. It says, okay, says, Doctor, please, how true could this be? Someone told me that a woman can have pregnancy loss without seeing blood. Could this be true?
Dr. Fred, you dey hear me?
Yes, 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 yes.
The noise still dey?
Yes.
But there's nothing making noise in my house here. They supposed to be making noise. I've switched it off.
Okay. Go ahead. Go ahead.
Okay. um, so in medicine, you not go always never can say never. Anything is possible, but most cases the person must lose blood before we go say yes, he don miscarried or the pregnancy don comot. So once the person don see blood, most of the time e mean say either the person was never pregnant before or the pregnancy still dey. Or another thing fit be say the person just get will I call it ectopic pregnancy, wey be like say maybe na outside the belle, outside the womb na the thing for happen. So at the first stage you fit not see blood on time, but later there will always be some element of bleeding. So not I you remember the first thing when I talk, I say never say never in terms of medicine, but if e dey very very rare. But every case wey me don see, the person blood must come out before we know say e don miscarry.
Okay, thank you, Dr. Israel. For those who just the comment, I beg, help us share this video, like, invite your friends. We dey take questions today, question and answer, but we no go prescribe medicine for anybody. We know they make diagnosis here now to just educate you in case this na your first time on the page. That is why I have to say this. We have a comment here from Josephine. He says, "Good evening from Benin. Is there any test to check the genotype before birth and which hospital?" Yes, the test day. The woman is pregnant. The woman get belly. Dr. Israel, that noise is still there. I don't know why. They make small noise. I don't know if people can see here, but I can. Yeah, I can still
Shall not be
be like.
Shall not be your earpiece?
I don't know. It's not mine, but it's still there though. Let's continue. So yes, the test day, a woman will get belly, and they will fit test the pikin for her belly. The hospitals where they do now hospitals and lab. I know if they call their names because I don't really know them per se. But yes, they do for Lagos, Abuja, even Benin. I think so. The amount maybe between 200 to 300,000 naira. Between 200 to 300,000. Yes, they happen. But I know if you tell you anyone now because we don't get any direct contact or link with any of them. But yes, it did. Okay, Israel, you want to add anything to that so that we go to the next one?
No. You don't talk an
Okay,
day.
yeah. So this
Make the
person
person
says,
just try and see, go big hospitals.
yeah, go big hospitals, they go help you. I take water a lot and I don't use red and yellow capsule. And so listen carefully, Madam Dr. Israel. Um, so as I mute your mic, this thing stop. It stop. Now from there, try go your settings. Go to your mic settings and set your mic again. Or refresh. You understand? So Esther, Madam Esther, I take on and beg you. Red and yellow capsule and flagyl no be for any type of diarrhea that is watery stool. Our people just believe say whenever they go toilet they pass watery stool, they must buy flagyl and red and yellow capsule. It is very wrong. You don't dey pass stool for 1 month. Flagyl red and yellow capsule will not help you. You have to see a doctor. This one don't pass normal. I beg. What about menopause? What about menopause? What about it? Somebody says, Dr. Israel, how to get rid of too much sleep? How to get rid of too much sleep? Uh, okay, Dr. Israel is not hearing me. So to get rid of too much sleep, I don't really understand what you mean by too much sleep. Or the definition of too much sleep, no, they clear to me. When you say how to um, get rid of too much sleep, so I don't know what you mean by that, but normally an adult you need about 6 to 8 hours of sleep as an adult. Some people need 6, some 7, some 8. Some people even take 5 hours of sleep and they go day okay for them depending on their body. But basically about 6 to 8 hours of sleep 9 day okay for you. So I don't know what you mean by the word too much sleep. Hmm? Yep. If you just dey come, help us share this live. Help us share.
You still
We
dey hear
have
the
it.
noise?
Yeah, it's still there. It's still there. It's still there. No problem. Let's go ahead. Don't worry. Mm. So, good evening. What is the difference between SS and SC? Uh, Make I explain. Okay.
Explain.
So, okay, quickly. This your question. Now, very technical one, but make we try within 1 or 2 minutes. Every human being get red blood cell, blood inside your blood. Now, inside that your blood, you get what they call hemoglobin. Hemoglobin, now they carry oxygen around your body. Now, the normal hemoglobin, normal, now A hemoglobin, because of a lot of factors there. A. So we get abnormal hemoglobin. So we get S hemoglobin, we get C hemoglobin. So some people get AA. So when you hear them AA, so they have two normal hemoglobin. Some people will get AS, means they have one normal and another abnormal hemoglobin, AS. So A is a normal, X is abnormal. Some people get SS, so they have two abnormal hemoglobin. Some people get SC, so they have abnormal S, that is the S. They have C, which is another abnormal. Now, for the two of them, SS get more problem than SC. You understand? SS get a lot of problems, while SC get little problems, but they almost look alike. But now SS get more problem than. I hope this answer try. We have a question here. It says, please, what causes sharp pains from my left upper abdomen?
Your left upper abdomen, it contain some organs. So anything when go affect that organ, most of the time go give you pain for that place. And it go give you pain for that place. And the stomach dey there, the left lung extend reach there some small, the spleen dey there, and so on. So anything wey go affect those things go actually cause a little pain, and go cause pain for you for that angle. So na that one na dey cause pain for there.
Okay.
Then if you also get trauma to that place, injury to that place, you will still get pain for there.
Okay. Doctor, why do women have pains at her spinal cord weeks or months after having a cesarean section? Dr. Israel. Okay. My respond. No be
Yeah, I dey with you.
that noise still there. Oh my, ladies and gentlemen, can you hear any noise? I mean, only me to hear them. Okay, so no be every woman will do cesarean section. Ah, no be every woman will do cesarean section. Then go get spine pain for the spine. No be every woman. Now few women. And because when they do CS, sometimes they give some women injection for the back, and that's that stuff it cause them pain. You understand? That's one. Now one. Oh man, let me see something. Let me see something. Okay. Let's take another question here. Let's take another question here. Good evening. Dog, please. I see you, Alex. I see you, you tread. I see you, Mr. Alex. I see you. What can I do? What can I do for menopause to calm down to So Israel, do you understand this question? What can I do for menopause to calm down too much heat? Dr. Israel, want to respond? I don't understand.
Okay, maybe now the symptoms when they get from the menopause, now they try to talk
Okay.
about.
Yeah.
So uh, I think there, well, most of the time we dey always say as far as menopause now, something when people must actually pass through. So I think you just try to manage the pain or the heat or whatever, or the pepper, like say heat the worry and all those things. So you just have to manage it. And there's no serious thing you need to do to make them go, except you want me to see your menses again. So, but if you don't pass that scene of menses, I don't think you have one thing where you need to do to make and go. So you just have to manage it. Manage it one kind within yourself so that it will actually go. So you don't need one drug or anything like that.
The noise don't disappear. Okay. So for the person asking us too about menopause, again, we will advise you try to see your gynecologist in case the thing they very very bad. And try to see your gynecologist. Maybe if they can get any advice for you, they go fee give you. You understand? Um, we have a question here. Says, please, doctor, what causes swollen legs in some pregnant women?
Most of the time, when we say swollen leg for pregnant women, two things. One, now better thing. One, not better. So if he gets swollen leg and the leg not the pain am, we dey happy, na better thing. Wetin e show say yes, the placenta wey dey the belle, blood dey enter well and the pikin dey get enough blood supply. So the pikin and the placenta, everybody dey well, na make that swollen leg happen. However, when the person come get the pregnant woman get swollen leg and e dey complain say if you touch the leg e dey pain am, abeg you need to go hospital immediately. That one no good. When the swollen leg dey pain am, that one no good. So if you get that kind of thing, you need to go hospital because they will need to do some other tests for am to find out some other things, and it also concern the pregnancy. So, but the good thing I will tell you is that once you go hospital, there's nothing to be afraid of. Not be say they'll say una one bad thing they worry you do. So you just need to go hospital. They go monitor you and try to do some investigation and some things for you so that that pain for the leg and even the swelling feel reduce. But if na e no dey pain you at all, e swell, no worry yourself. The only thing wey you go just do is that when you sit down, try raise your leg up, try raise your leg up, put for somewhere, make it for no dey too swell. So no just worry yourself.
Yep. Mikoyo, Moturayo, Organa Gifted, Kingsley, Simona Racine, Felicimus, Idara Smooth, Uba Mimi. I see you all. Thank you for clicking on the like. Thank you for liking the live session. Thank you very much. And then if you just come, help us share the live. So we get question here. We get question here. Get away. He says, please, how much is IVF in Nigeria and surrogate mother, if you have any idea? So, Chi Thompson, I don't know. Make I respond quickly because we had a live session 2 weeks ago about IVF. We had a guest on the program and she spoke the amounts. I don't know, Dr. Israel, did you remember 1.5 to depending on so many factors? So waiting go good for you. You go good, me just go for that video, watch everything. She spoke, is it 1.5 to 5M? I can't really remember, but now so it be. And then the amount they dependent on so many other factors, where they go find from the woman or even the man. Do you get so many things like that? And if you want to know more about IVF, I go beg you, try go watch that live session. And then for those where they come this page, we get many videos where we don't do for you, but people know they won't watch. Help us watch. Okay, Dr. Israel, we have a question here. He says, It's almost 1 year now that I put to bed, and I haven't seen my menses. Is it normal?
If you are still breastfeeding, most of the time are normal. You don't need to fear. In fact, in most cases, most people when they just newborn and they see they carry their pikin, breastfeeding and all that, most of them know they quick see their menses. Also, sometimes before they go even see their menses, they feel not taking again. So two things involve. So it is actually normal not to see your menses even for that 1 year after delivery. Mostly if you still a breastfeed.
Okay. Somebody says when a child sleeps too much and you have to shout hard before the child wakes up. Okay, so for someone that sleeps too much, I really don't know what to tell you, Dr. Israel. Do you have any way to respond to this? Complaining that the child sleeps too much.
Well, most people have different way when they take the sleep. We have deep sleepers and we have those when not they sleep when not they sleep deep. It's not like they sleep too much. Now just the deepness of the sleep now be the thing.
Yeah.
And also some part of speaking join for children to they sleep deep like that. Mostly when they don't use their full day take play. What do you expect? Majority of them will really sleep deep because they don't tire well. So for a child, I don't not to worry yourself. Wake up, you go wake up. Not be anything to be afraid of.
Okay. We try to day fast. We dey use 1 hour. My eyes do disturb me anytime I'm pressing phone or watching TV. What is the cause?
If your eye they disturb you when you dey press phone and watch TV, I beg go see eye doctor. You see me dey wear glass, not be say na fancy. So go see eye doctor. You get the best solution to the problem. Yeah.
Yep. Your eye they give you sign. Huh? Your eye they give you sign. The best thing to do now take your eye to the eye doctor, make them check your eye and tell you what you could do, whether they will give you glasses or something else. You understand? That is our advice for you. On this page, anybody where they ask us for medicine, somebody is asking a question for medicine. We know they prescribe medicine. If you get any medical disorder, medical challenge, we will always tell you to go hospital. Hmm? Yep. Okay, we have a question here. If a woman stops seeing her period from 43, is it menopause?
Okay, it depends. We don't say menopause. Most people menopause is from 45 to 55. That's a normal age range when it they start. But you never can say never. Some people they even enter that we call them early menopause. Some people they enter menopause even at the age of 40, and some people they enter later. So it's possible that now menopause 90% just enter. Mostly when and you should also know say that within that age, for most persons, their menses go down they do one kind, go down they come, they come, they go because they don't they near menopause. So if you know you're going to see a menses again that time, most likely if you don't be say you don't enter menopause. The only problem now be say the menopausal symptom go your long finish. Apart from that, I don't think you should be afraid. Mostly if you know say you don't born your children finish. I remember when you never born your
Yeah.
children finish and you are in menopause, uh, things they when they go physically do when go see make you born. So you need to just see your gynecologist for that time during that time.
How many times is a woman supposed to do cesarean section?
Well, I will not want to put any time how many times for you. So it now depend on the individual. So some people they very strong that they want to do that times, but it's not advisable. So if you don't do three, four, what? Why will you want to continue stressing your yourself because that na stress to yourself, not just to the one alone. Na stress to yourself. So it is better that because we already know say when you do the first one, the second one. From the second one, it's already a cesarean section. So it is better you just do 2, 3, 4, and you should be fine with that. And please, just try not to go put yourself for another place. And these are still determined based on how long you take stay before you go do the second CSO. Not be say you do CS this year, you do next year, you do the other year. You want to do 4 times. You go just in fact the womb self not go even let you do it like that. So even when we say yes, you can do up to 4 times, doesn't mean that you do it every year. So when you give a lot of space to allow the first wound when they the wound it heal, then you can actually do up to 4 times.
Okay.
But it's better you see a gynecologist to give you a good thing to do.
For those on YouTube watching us, make una drop comments. I want to see the people on YouTube. I want to give una a shout out. We get about 5 people on YouTube right now. I see you all. Please drop comments so that ma mention your name. We get comments here. Thanks for the first answer. A friend of mine, they just got married. Both of them are AS. That was the reason I asked that question. Okay. Please, my mom has ulcer and she's having pepperish sensation in her legs. What could be the cause? Is there anything she can take? Dr. Israel, okay, please respond.
Peppery sensation in her leg, what could be cause what could be cause? Okay, see, most of the time when I ask us some things like what will be the cause of so thing, and then like you want me with the diagnose some things, and we're not the diagnose for yet too. So that's why most of the time I'm not sure say you don't yet say we don't want to tell you say now this thing I cause this one for you, now this one I cause this one for you. So go treat things. No. So what we'll try to do is just to try and make sure that we give you the best, and so that you go fit do get the best. So that's what we do. So what I would say in that case, many things will make your mama leg dey hot. I don't even know how old is your mother. So if your mother never too old, like is still within the 50s or so, it can just be postmenopausal symptom. I they even call that leg to hot. So another thing, many things, different things can actually cause it. And the ulcer when you get that one you're different from what they cause that leg to the hurt. So I think the best thing to do is to go to the hospital so that they can see her, investigate everything concerning her, and give you the best treatment. So for that your couple that are ASAS, well, if they have the financial stability, no problem. It's not a bad thing.
Okay, so it says, okay, it says that surrogate question is very important. Please buttress on it. Yep. So concerning this surrogate, the reason why we skipped it was because we've already addressed it in a previous video. So anybody that really wants to know about surrogacy, the amount is in that video. And again, we don't engage in it, but the doctor who engages in IVF and assisted reproduction broke it down. So I want anybody who wants to know about surrogates, or even IVF to go and watch that video. Now, there's something we need to say here. This page, we they try to provide information. So when we come online like this, we they provide many topics. So in case you ask us question and we don't do the video before, we will tell you, may you try, go back, go watch out. Make you not be like to say we they repeat ourselves and make we feel manage time. Yeah. We have a question here. It says, what's the test to do to check heart condition?
Okay, for heart condition, many tests when you go feel many tests when you go feel do to check heart condition, a lot of tests, and it can depend on your pocket. But the easiest one, the first one, let me just mention like 2 way there is the one at ECG. In fact, ECG, that's the first test where you feel do to check any heart condition. Another one at echo, echogram, echo echocardiography. So, yeah. So that's another one when you fit do. So and you can also do some other investing, even MRI. You can do MRI. You can do CT scan. Hmm? All those ones go just for the CT scan. It not go show you many things, but your ECG, echo, yes, all those ones will actually show you a lot of things. Even the MRI will also show you a lot of things. So those are our tests when you feel do. But for this country, when we dey, some of these tests they a little bit expensive, but ECG not expensive. ECG not too very expensive. So when you think say you get heart issue, you need to go and see a specialist, which is called a cardiolo- cardiologist. So when you say cardiologist, he will be the best person to tell you which of the tests. All those are one I don't mention. He will be the best person to tell you which of them you go do. So that means you not go do test finish. You go waste 100 something thousand finish. You can't go hospital. The doctor you say you never need those. You never need any of those things. Maybe not just chest X-ray you need. So you also need to know that. So if you think say the things in a heart problem you get, I beg, go hospital. It's very important.
Okay. This question we don't address them so many times. What are the signs or what are the signs or symptoms of HIV patients? Oh my God, Dr. Israel,
Okay.
please respond.
Okay. If you really want to know the signs and symptoms of HIV symptoms, patients, I'll just talk one or two here, but I expect you just follow my page, eh? The HIV series we dey do now, you go see I don't put something about the signs and symptoms of HIV, and we call am wetin person go notice before you go think say na HIV na you get. So the first thing I will say the person feel dey asymptomatic, meaning say if he not get any symptom at all. So in that kind of case, the person fit even stay for a very long time, almost as long as 12 years sef, you not go get any symptoms. However, sometimes if you can get just normal malaria symptoms, but this time you go dey treat malaria sef continuously, and the malaria no dey go. If you go today, you go come back. So then you notice the body dey hot, almost 1 month, the body just dey hot. Then another thing I will say, if you dey purge, go dey purge for more than 2 weeks, more than 3 weeks, e still dey purge, and the purge no green go. So as at that time, you need to go do test, you need to go do HIV test because you never can tell. Now you should also know that all these symptoms when we dey talk so, all these symptoms when I dey talk so, e no mean say once you see patient with all those symptoms, say they get HIV. E only mean say make you go test yourself. Say one of the tests wey you need to do na HIV test. Another one, you dey cough. So when you dey cough for a long time, you also need to check yourself. For that cough, you even need to even check for TB too. So these are some of the few symptoms when you go notice, and then you will think say yes, this could be HIV. There are so many things. In fact, anything when you think of, any symptom when you think of, if it come with HIV, that's as funny as it is. If you say you dey peace, if it come with HIV, so any symptom can come with HIV.
Okay.
So that make we see the advice. That make we see the advice. At least we need to test ourselves most of the time. Just go. Just go and test yourself. If you test yourself now, after the next 3 months or 6 months, you need to test yourself again. Just test yourself, even though you not get any symptoms.
Okay, we have a question here. It says, please, doctor, how to control chronic gastritis?
Dr. Fred, answer.
Okay, so when you say chronic gastritis, number one, we won't really dey sure say you know what you talk about and the diagnosis they confirmed. Hey, you know they use word where you don't know. Now, if you get chronic gastritis and now doctor make that diagnosis for you, they will tell you say make you avoid anything with it trigger the gastritis, meaning say if it cause you pain. So avoid hunger, avoid starvation, avoid alcohol, avoid smoking, avoid food wey go cause you that irritation. For some people, like beans, alcohol, coffee, caffeine. Some people will even take orange juice. You go give them heartburn. So for you, now for you to avoid any of those things, we go trigger your gastritis. That's number one. Number two, you get some medications too, where your doctor go prescribe for you. Those medications will help you manage your gastritis. Now, why this in the day hard? They say some people believe, say when they take the medication for like 1 week, it don't dey cure. Sometimes this medication, if you take it for 1 month or even more before you go get total relief. And even when the symptom don't go, it no mean say it don't disappear. You need to maintain that lifestyle for a long time, because gastritis just be like say you get wound. Be like say you get small injury. So if you continue for the same thing where they do, that thing if you go back and cause you problem for that area, inflame the area, cause them to start giving you pain and other symptoms. So basically, now the few advice for those who get gastritis, whether acute or even chronic gastritis. But most importantly, stick with the advice where your doctor give you. Ibrahim on YouTube, I see you, Ibrahim. There's a question here. What is the best remedy for mood changes in pregnancy?
Did they hear me?
Yes, loud and clear. Go ahead. Go ahead.
Okay. So, sorry. I better bring the question back again. Make I say, I'm sorry, my hand mistake first. Okay.
What
What's
is
the
the best
best
remedy?
remedy for
Yes, mood changes. Okay. Hello, Dr. Israel, do you hear me? Oh,
Yes, I hear you now. Man,
oh yeah. Let's go. Let's go.
okay. What is the best remedy for mood change in pregnancy? Okay, you know those mood change they come once in a while and hormone issue and a hormone issue. So I don't know as I would say this is the best remedy for that. I think it's like a phase in pregnancy. And although they happen to everybody, but now hormone issue now until that hormone still release itself and the mood go still change. It just like not just mood swing. It comes and go. It comes and go. So what you need to do when you notice say you get mood swing, try to do those things that makes you happy. Anything where you know say they make you happy, just try to do them. So those are the things that will even change your mood gradually. So not stay in a lonely place, not stay alone, so that you know go dey sad or moody. Try to dey where people dey and talk. Then if na that one dey make you happy, do it more so that you'll be happy.
Yeah, thank you, Stella, Musa, Nsika, Mary King, Edokbai, Josephine, Steph, uh, Florence, Doris, Chiwendo. Thank you for the likes. Thank you for liking the video. And for those, if you never share the live session, share. Dr. Blessing, how fun? Happy Sunday. Um, so we have a question here. It says, Doctor, please, if my sperm is not thick, what is the problem? Please tell me.
Well, I don't know when you say your sperm is not thick. I don't know what you use on me. We know they measure the quality or the perfection of sperm with your eyes, looking at the sperm and say the sperm not thick. Now, most of the time when people they say they are sperm not thick, it just maybe they have sex more frequently. So when you have sex more frequently, there's every tendency to say the sperm not go thick again, go your day a little bit light. So we know they use that thickness, as you dey talk say they look whether the sperm go fit give pikin or not. If na that one make you dey act, the best thing wey you need to do is to go to the hospital. Make dem do test for your sperm. So with that test and the result, we come know if the sperm go fit produce children or not.
Okay. We have a question here from Uba. Can pregnancy cause liver problem?
Okay, I will not want to say pregnancy can cause liver problem. No, pregnancy on its own, will I say is a good problem on its own. Let me use the word good problem. Let me say that problem. So it's a good thing on its own. However, it can affect every system within the body. It can affect every system within the body. So if maybe your liver don't feel they get small problem, yes, pregnancy because of the stress fit make am come out small. Not me say na im cause am. Not be the pregnancy cause am. In fact, pregnancy no the only thing wey pregnancy dey cause na you giving birth to a child. So not be say e go cause any problem for your body. The only thing e can, if there is something wey dey there before, e fit make am get up, e fit increase am small for you. That's just it. Not be say na im cause am.
Oh, so my mic has been muted since. So pregnancy no be sickness. Pregnancy no be issue at all. But some women they fit get problem, and then when the problem day and pregnancy enter like that, if you make the problem show, just like how Dr. Israel talk. We don't take questions. We don't answer so many questions right now. We go soon end the live session. But once again, I want to talk something. In case you dey watch this video and you dey try send any of us private messages, sorry, I know they do private chat on social media, no vex. This is why we dey try come online like this to dey respond to questions. But privately, we know they do any consultation for social media inbox. If you want do that, we go beg you, may you go follow your doctor. Wherever you dey, go follow your doctor, talk. If you really want follow us talk, you go book for consultation. You go book for them, you go pay for that private time, and then we will look for any time follow you talk. But say chatting on social media privately, no, it's not our thing. Yeah, no vex. We have a comment here. It says, please, doc, explain postpartum depression. Okay, Dr. Israel.
Okay, postpartum depression. This one a depression when they follow after delivering. When they happen, you hear that the noise. Okay.
No, it don't reduce well.
Okay. Now depression when they follow after delivering and 6 weeks. 6 weeks after delivering, within delivering time to 6 weeks after the person born. Now, like normal depression, it's just depression on its own. But now because it happen within that period, now make we they call them postpartum depression. And it get the same signs and symptoms with depression, like low mood, the person not want to eat, the person go they cry. And most of the time, the reason when they happen and they because he just born. So sometimes the woman feel they look the pikin like problem to run, so you go into depression. It looks say his shape don't change, so he not go dey like his body as they see his body again. Breast will be stand on the fall, belle wey go inside don't come out. Body wey be figure 8 don dey turn 3 people body, just like that. Those are the things when some women they see and they go. They push them into that postpartum depression. And sometimes even the cry of the baby just they cry. Then they self not fit make the pikin stop crying. So these things can actually push them into depression. So if it's not well managed, it can just become a lifestyle for that person. You just come there, get depression like that. But when it's well married with psychiatric doctors and the gynecologists putting their heads together to manage the patient will feel well and they okay after the episode. So most of the symptoms when the person go get, most of the time, as I said, low mood, you go they cry, low libido. If you know want they eat, sometimes some go they eat well. So that's eating disorder. So if it decide say no go chop, or sometimes you go they over they eat. Some of them go oversleep because they are very weak. And sometimes they may get some somatic symptoms, what they call say symptoms will not really dey there, but they believe say they there, like body pain, headache, belly they pain them. Whereas it's not really there, now just their mind, nine they do am.
Okay. We go soon end the live session. Huh? Somebody they ask us here says, my friend said this is his period. Okay, I think now lady, on the 8th of June, when will you start seeing what? Obute, your comment or your question is not clear at all. What is the cause of frequent heat? Also, Israel, want to respond?
If light not there, go cause heat. If you if na woman and you don't dey go menopause, yes, that one na one of the major cause of frequent heat for women. And that na one of the major cause of frequent heat for women. So hormone issue fit also join, because woman own a hormone issue. So for other persons, it fit be hormone issue. So another one, obesity fit lead to that frequent heat. People will get a lot of fat for their body, and they get heat like that, and they get heat like that. So many things can actually cause it. Many things can actually cause it. Another thing with physical and if you don't get problem with your thyroid gland, they get one organ where they the neck here. If you don't get problem with some persons they come down with too much of heat, and when they don't they get problem with that. So if you think say you they get problem with too much heat, I think you should see your doctor so that they can evaluate and see if other things, other symptoms they when accompany when join that too much heat. If other symptoms they will join that too much heat, then they go know what they go tell you.
Thank you. So, hello from Australia. Oh, really? Smile for me. Australia. How is Australia now? We have how many more minutes? A few more minutes. Okay. Any of your video on lung infection? Not really. Signs and symptoms of lung infection. So we get many types of lung infection. We get bacterial infection of the lung, viral, even fungal infection of the lung. So many types. But commonly, when somebody they get problems with the lung, infection of the lung, you hear a person go tell you say maybe you know if you breathe well. Sometimes they fit get fever, they fit get cough. When they cough out, they fit bring out some things for the cough, difficulty with breathing. And these are common signs, say problem day for the lung. Now, depending on what they cause the lung infection and the severity, we can determine the type of symptoms that the person if get. But basically, some people will get cough, difficulty with breathing, fever, some people get chest pain, and a whole lot. So, Israel, anything to add?
No, many things there. I think what you just said, those are the simple symptoms. You get cough as well. Hope you mentioned cough.
Yes.
So those are the beginning symptoms. So when you don't get those things, I better go hospital because it not be something when they take the place.
Okay, we are almost out of time. Is constant bloating during pregnancy normal?
Okay, bloating in pregnancy. Say many things they happen during pregnancy. A lot of things, and they happen to the mother during pregnancy. This one na because one the womb where the pikin dey stay, e dey big, and as e dey big, e dey push every other organ go corner. E dey push them go corner. So because they push go corner, many things go just dey happen to them, which you don't need to be too worried about. You don't need to be too worried about. You notice say most of the time the person go dey piss. Now because the womb don't rest on top the bladder. Another one, that blood thing, it go make sure they cause hair to they enter the stomach well, because it don't push the stomach go up. So all those things they make people not to eat well. Once they eat small food, they don't belly full, but your blood say that they eat too much. So you don't need to fear, or you don't need to trouble yourself when you start having such thing. However, you can actually still go and see your doctor or your gynecologist, so that he go talk to you and give you more tips on that.
Okay, we go to end them for those who just they come, and if we know if you take your question, no vex. So let's see. This one says, my friend says her period 8th of June. When will she see her period, and when is her ovulation? So your name is what? Sunday again? Next Sunday. You cannot just come online and say my period now 8 when I go see ovulation when we don't know anything about your period. You need to know the length of your menstrual cycle first of all. So what will be the length of the menstrual cycle? Is they regular or not? So many factors they involved. So if she know the length of her menstrual cycle, she might be able to calculate her ovulation and know when she will see her period again. If it dey regular, very good. Next one again, they say some kind applications dey where she fit download for her phone to help her. Or if you go my YouTube channel, go my YouTube. Videos dey for YouTube on how to calculate your ovulation, how to calculate the length of your menstrual cycle. It was broken as simple as ABC. Watch them, it will help you or your friend. We get a few more minutes. Somebody's asking us a question, says, please, what are the causes of vein pains?
The question to this answer now, how you think no saying a vein they pain you? That's the question to that answer, because you cannot just say vein pain. That's a very that's a very big and I don't know how to put it. So you cannot just say vein pain. So how will you say? How do you know that it's vein that's paining you? The only time when person fit say vein they pain, and when you get varicose vein, when the vein, all those veins, all the thick, they make big. So people fit get pain during that time, and most of the time, whenever they say that they okay, during that time people fit get pain. Yeah. So most of the time, you need to even first see doctor self before you be even think whether or not vein they pain you. So I think that's what I would want to say on that.
Yep. Domingo Manuel Ibiso, Best Man, Victoria Peter, Chituga, Victor, Dadson Praise, Felicia, Musba, Kafayat. Thank you for liking. Thank you for liking this live session. Thank you for those that are sharing. We have a comment here. It says, is there any cure for human papilloma virus?
Human papilloma virus. Anything viruses, most of the time, most viruses don't have cure, and you can actually manage them. You can actually manage them and keep them to that state when they not go they cause many wahala. Now I don't confuse human papilloma virus with some other viruses. Now my head just full of so many viruses. So but the thing is that Episimplex, okay. I beg, Dr. Fred, remind me what human papilloma virus it comes.
Cervical cancer.
Oh, okay, thank you. Yes. I was thinking, yes, there's no cure to human papilloma virus, but you should know that there are different types of human papilloma virus. And there are some that will cause cancer, as the doctor of cervical cancer. There are some that will not cause cancer, but they can just, those are also not go cause cancers that they call warts. Some of them they cause what? Vaginal wart, anal wart, and all that. So they not really get the virus. The virus itself not get cured, but that cervical cancer, when they know on time, we fit cure am. Then the anal wart or vaginal wart, when you come hospital, there are things when we go do to also take treat am, to take treat those warts. But say for the virus itself, the human papilloma virus, no, e no get cure. But with your immune system, if your immune system dey very very good, e no go do you anything. Mostly those one wey no go cause cancer.
Okay. And you can take vaccine too. Vaccine. So we get vaccine. What did they give
Yes.
for prevention? So for those whenever they
Yes.
exposed to the virus, if you give girls, if you give boys the vaccine, so parents where they listen to us, try look for the vaccine. Go to any teaching hospital, tertiary center, government facility, ask for the vaccine. Give your daughters, even from as young as 9, 11 years, if you give them to protect them
In fact, na
from
that age na im work pass. Na that
yeah.
age e dey very active pass when the girl don or the woman don dey sexually active.
Yeah, very good. We are out of time. Let's take the last question and then we are done. This question says, good evening, please. What's the cause of ear infection?
Okay, many things fit cause ear infection. Bacteria fit cause ear infection. Virus fit cause am. Fungi fit cause ear infection. So those are the things that can actually cause ear infection. And those are the things that can cause ear infection. So the thing now is, if you dey get ear pain, or you no dey too hear, just go see your doctor. You need to see ENT, those that are specialized in the treatment of ear, nose, and throat. Now they go come look inside, come do test, come find out wetin cause that your ear infection.
Okay. Thank you, everybody. We need to end this session today. Yeah. I don't know, Dr. Israel. I've Okay. Is it after childbirth? Is it possible for the mother to be pregnant without seeing period? Oh yeah, no. Please
The answer
respond.
is yes, it is possible, because ovulation dey come before period. Without ovulation, period no go fit occur. So most people, before they go even come go see their period, because ovulation don start, because ovulation don come, and they don meet their husband or their partner, sorry, they fit don collect belle. Okay, that's it.
Yes. So sorry, everybody. We have to go now. We did try work with time on this page. We use 1 hour. We start 8 p.m. By 9 p.m. on the dot, we round up. So in case you just they come and you just they enter, they ask us question, no vex. Maybe some other time, maybe they live again. You join us. We will try to take your questions. No vex. So is there any final words?
Okay. Why can I just continue to try and live healthy? We know say the country now, for Nigeria, those watching in Nigeria, many things that they are hard, and it will lead to mental health issues. But let's also try to keep ourselves calm and make we for not come enter depression or come by ourselves cause problem for ourselves. So let's just be good and try to keep a good hygiene and good healthy living.
Okay, thank you, Dr. Israel. Thank you to everybody who watch this live session. We want to say a very big thank you. We not take your presence here for granted at all. Thank you for liking. Thank you for sharing. Thank you for commenting. We say a very, very big thank you. This page, our job here now to teach. We know they prescribe medications. Neither do we make diagnosis. We are very clear on that. We always beg you, wherever you find yourself, please and please speak with your doctor. Nobody they interested in looking for patients online. Our job here now to teach you. So in case you they send us private messages, no vex. Nobody's going to respond to that. Neither will anybody give you phone number. And we get our private lives, and we want you to also respect that as we do our best to help you. Take care of yourself and remember, good life. Now waiting, good life, good life. Now sense. Thank you, everybody. Thank you, and have a wonderful evening. Bye bye, guys.